Everybody, I am so excited. We have Dr. Grace Peng with us today. I'm sure this is her favorite intro, but some of you may recognize her beautiful face from the show Botched. She trained under Dr. Paul Nassif and is now running her own clinic in Beverly Hills. She is married. She's a mom of two beautiful babies, and she is a facial plastic surgeon. I've seen her speak at so many meetings. She really just kind of does it all, which, Grace, if you want to give folks a little bit an introduction on your practice, and then I want to jump in and ask you a bunch of questions about your practice
Yeah,
starting
sure.
out. Yeah.
Yeah, so I finished fellowship in 2015, and since then I've had my own practice. But when I first started out, I was actually in the same office as Paul Nassif, and it was great. He was one of my, and still continues to be one of my lifelong mentors. And so I had my own practice within his practice, and it was a perfect place for me, and I really, really enjoyed it. I know some of you may be familiar with like the story and everything. And I actually did a podcast with Ed Williams on this, but about 2 years ago, Paul actually joined a private equity firm. And at that time, I thought it was my time to do what I really wanted, which was to have my own practice and to run it from start to finish and really run it from like the little bits to the big picture. And so it's been really fun adventure for me. Paul Babak and I still share fellows. And so we have two fellows a year as part of our fellowship program. And so literally we're still in the same areas. I could literally see Paul's office from my office window, and I still operate at the same surgery center that I have been operating at for the last 10 years. So it's like a big change, but actually a very small change when it comes down to the logistics of things. It's just been a really, really fun time. And I was looking back and I was thinking it was almost 2 years ago when I first, picked a place and kind of made the decision.
And talk a little bit about setting up a practice in Beverly Hills. I mean, I know that a lot of like young aspiring surgeons in our world, that's like the creme de la creme in terms of real estate and other physicians. I mean, had you considered going anywhere else? Like, is that where you and your husband wanted to be?
No, actually, I just never considered anywhere else. I had done all of my residency training, actually all of my undergraduate medical training at USC, and so I've been local. I grew up in Palos Verdes, which is a little southwest of Beverly Hills, and never thought I would move back there by any means because it's very far. Those of you who know LA know that after you finish going on the freeway, you still have to like traverse all these other roads to kind of get to where PD is. And so I actually moved back there right before the pandemic, and we found a house and everything. But I had always been in Beverly Hills because it's where I trained for fellowship, and I never really thought too much about it. I do think it's an area with a high concentration of a lot of aesthetics. So whether it be like facial plastic surgery, any sort of other aesthetic health procedures, ranging anywhere from med spas all the way to surgical procedures. I feel like it is truly the mecca of aesthetics. And I never really thought twice about it. I did think, though, when I was going to start my practice, I would still be here in the same area and probably be in a very, very similar location. Just because I felt like over the years, I've curated my practice and have all these patients that are used to this location. And for me, I was just going to maintain that same sort of location and area for them and never really thought twice about any other location. Though I feel like in the future, as you expand, having multiple locations actually is kind of fun as well. For now, I like having this as my home base, and I like having one location because what's most important to me is things like surgery center with the team that I always work with, my clinic, having the same team I always work with. And it really makes my days quite smooth, but in turn, that also leads to very, I don't know, very smooth clinic days. So it's less waiting time for the patients because everything is the flow that I've created in my practice. So for now, here, and it's been really, really fun. It's also really fun that every building, like down the block, 5 minutes, walking distance, all your colleagues and friends are around here because there's so many people here. So
Yeah.
it's pretty fun.
So 2 years in to your own practice, give us a sense of who is on your team now and how is your average week set up?
So, to be totally honest, it's 2 years into my own practice, but I feel like it's just me doing the same thing that I have been doing. So,
Yeah.
a little side note in the sense that I feel like it was a lot easier for me to make this jump than maybe when I first started, like, finished fellowship. When I first finished fellowship, I was definitely not in the mind space to be like, let me create my own practice because I just didn't know so much about life, even. Definitely not about business. Not that I know a lot more now, but a lot of things come much more naturally just because I've had a practice for the last 8 years. And so now these 2 years are kind of in a different location, but it's really largely kind of the same thing that I've been doing all along. I was really lucky that even in my previous location, I was able to have a lot of autonomy. So I had a lot of autonomy for how I wanted to run my clinic, my practice, and create a brand that I really like. Because of that, I felt like starting my own was very different than just immediately starting. That having been said, I think anybody can do it at any time if it's something you want to. So on my team right now, I have a nurse. I have who helps me also in the operating room. Actually, let me start and make it more like kind of clear. But on my team right now, I have a patient care coordinator and someone who assists me. So she's sort of also like my practice manager. Of course, when you have a small business and you start your small business, you'll realize that you kind of want to be the practice manager, but you don't have time for everything, especially now. I feel like I have, you know, I'm being pulled in so many directions, not just work wise. And so my patient care coordinator, she's also my practice manager, and she helps me with a lot of different things, both from kind of the continuity of care for patients as well as kind of overseeing things from a practice standpoint, should I need like an extra set of eyes, an extra pair of hands, and just helping me with a lot of things that I may say, hey, I need help researching into this. Because when you run a practice, it encompasses everything. It encompasses from HR all the way to your supplies, all the way to creating a environment that fits you and that, shows who you are as a brand. Everything falls under practice. And so you need some help with those things. In addition, I have a nurse, and she works for me, especially during the clinic days, will help for a lot of different things. But she's not an injector. So I still do a lot of my own injectables and non-surgicals. It's something I really, really enjoy. For me, I feel like it's almost a time that I get to socialize with my patients. A lot of
Mhm.
these patients may become surgical patients. They don't all become surgical patients, or some people were surgical patients and now I've assumed their care for other maintenance or different things. And for me, I think it's a real fun time for me to catch up with people. They've also seen me go through the transition of being at a different location, now starting my own place. And it's fun because, I'll tell them I picked the tiles and they'll be like, I love your tiles. So they've seen me through my pregnancies and now becoming a mom, which is still a new title. I forget sometimes that I'm a mom too. And so I feel like your patients are, there for you for the long haul. And so it's very fun to be able to spend some time with them, not while they're immediately healing or not right before surgery, but really just like the time where everybody has to socialize. And that's a lot of the non-surgical procedures for me. So that's still a fun part of my clinic. I also have two medical assistants. And so they'll take turns doing both back office stuff as well as in the front to make sure that there's always someone at the front desk. But really, I think it's really nice because I have about 4 to 5 exam rooms that I use at any given time. And so really, I need people to be helping me prep those patients so that the flow for clinic goes better. Some patients may be numbing, some patients may be getting their blood drawn for PRP, some patients are post-op and need their incisions clean, some patients need photos. And so I have a nice team that I feel like everybody is there to really help make the patient experience better. A lot of patients have told me that this is one of their shortest wait times for when they go for any sort of appointments. And I kind of take that as a compliment. even though there's a waiting area that I feel like I made, nice and cozy, I do want them to be able to feel like they can come in and out of an appointment, having gotten everything that they wanted to get done, but not being so delayed for like the rest of their day.
Mhm.
Like the rest of us, our patients all kind of make arrangements for to go to appointments and to make sure that, they have a certain schedule for either their time off or maybe they're fitting this in as part of their busy day. And so I like to be very respectful of that. And so that's basically my team. I recently also hired someone to help me with social media. She's remote and works part-time, but that's been really a fun additional aspect, and I'll report back on how that goes. So I've been running my own social media this entire time, which also is to a fault in the sense that when I'm very busy, that suffers. And so I thought it would be nice for somebody to help me stay on schedule and do posts and things when I feel like I don't have time to do it myself. The reason I've been doing it all myself is because I feel like it's truly my voice. Everything sounds like the way I would say it in consultation, the way I would explain it to people, or what I say when I give a presentation. It sounds like me. Um, Even the other things that are personal sound like me as well. And so to
Mhm.
keep it really genuine, it's always been me, but I feel like I also need a little bit of help. And so that's probably one of the things that I've learned transitioning into your own practice is how much help you need in different sectors, because there's a lot of work to be done. And depending on how well you want each thing to be run and how much needs to be done, your time is limited.
Yeah, for sure. And to talk about someone who's probably been is very influential to me. Sounds like you've had some words with him as well. Dr. Ed Williams, he talks about very rarely is the actual doer of the company also the manager owner. Like, most of our day is spent taking care of patients, operating, seeing them in clinic. It's
Yep.
hard to manage all of the business stuff, in the mornings and the evenings, in between patients.
Yes.
Um, I was going to ask about, and I don't know how sticky of a topic this is, but when you left Dr. Nassif and started your own practice, how did that work with, were your patients when you were working with him, were they free to come to you or how did
I
that
think
work?
in general, so just so you know, this may be a sticky topic that you may not want to include, but I'll say it. I think in general, honestly, patients have the right to go to any provider that they want to. I'm obviously very, very respectful of Paul and his practice. And because of him, I was able to start a practice here in Beverly Hills. And so I never wanted to do anything that would, jeopardize our relationship. And, honestly, we have a really good relationship. We had a great relationship when I was there and, yelling at him every day. And we have a great relationship now that I'm not there and still, texting him every day or talking to him. I would say that my patients, I actually did not inform anyone that I was leaving. But the day that I left, it actually is, I think, a legal part of leaving a practice that you have to let them know that a provider is leaving. Because of that, I just let them know that I was leaving and I would be in the area. I did provide any information that they would need if they needed to specifically find me for follow-up. But I also made sure they were aware that at the current practice where I was, that they could receive all sorts of care of any different type for their, whatever it is that they came to see me for. It's been really fun to see my patients back, and it's been really fun that they've come to find me. I don't think this is a specific example. I think this happens many times to many people who may change practices, change locations, and many times people aren't even changing practices. Like for me, my practice was always my practice, but obviously, if you were logistically looking at it, if you are part of the larger practice, technically the larger practice can assume responsibility or care of your patients. But I think you still have to let them know where you've moved to. So they
Yeah.
found me.
At what point did you have your kids? Because I know that a lot of us female surgeons, it is so daunting when you fall in love with surgery in medical school. You're like, oh no. The good thing is I found my calling. The bad news is I have no clue. At least I didn't. I was like, I have no clue if I want to be a mom. I probably want to get married, and I don't want to like take away my ability to like have kids and be a mom if that's what I decide to do. So how did you and your husband decide to do that? And what advice would you give younger potential female surgeons in that whole like arena?
So I think that's a great topic, and that could be like our next podcast part two, because I feel like that could be a whole topic in and of itself. First of all, I think it's your choice. So whether or not you even talk about, partners, spouses, significant others, I think it's your choice. For me, I never really thought I would love being a mom, but I always thought I was going to be a mom. Okay, so at some point in my head, I was going to have some kids somehow. But I do love surgery. And one of the funny things that I always tell people is I still think of myself first and foremost as a surgeon. Then I think of myself as a daughter because I think I'm a really good kid. And then I'm like, oh, but actually I'm a mom now because I have two kids, not just one. I have two kids. And it's been a really wonderful part of life. And I'm sure everybody who's had kids, who ever thought that, who knows when they'd have kids, probably feel the exact same way I do. I definitely probably had the problem of thinking I can always do anything, anytime, without any restriction. So it never occurred to me that it would be either or. It always, I always thought it would just work out. It would always just work out. And I definitely would encourage everybody that whatever you want, you can have. Whatever it is that you want to seek, whether it be like working very, very hard in surgery, becoming elite in your field, being a parent, being a good partner, whatever it is you want, you can achieve. For me, I actually felt like there was a right time for me to have kids. And it definitely wasn't in the beginning. I felt like I was unsure of my relationship to begin with. And because we're both so busy. So my husband's an orthopedic surgeon and he's also really busy. We both have our own lives. And it's almost like we have our own lives and then we have to figure out how we're going to make that kind of coincide. Um, But then I felt like there was a time when I was like, I'm ready for kids. Now, the backtrack, I knew that I wouldn't know when I thought the right time would be because everybody says there's never a right time. There is a right time. There's always a right time. But since I didn't know for all female surgeons, non-surgeons out there, all females, I think it's really important for you to freeze your eggs, potentially freeze embryos if you're ready for that step. I think it gives you the ultimate insurance. We buy insurance for everything. We buy insurance for car insurance, we buy disability insurance, we buy malpractice insurance. We spend so much of our money buying insurance on everything. And the ultimate insurance is ensuring potentially your fertility or ensuring the fact that you could potentially start a family at a later time or whenever it is. I didn't really understand any of that. To be honest, I really think that anything I want, I can achieve. But clearly, there are medical limits being a female physician, being a female surgeon. And those are things that people don't really talk about. Luckily for me, even about 10 years ago, I feel like people were starting to talk about these things on social media. And I wasn't even really on social media then. But a couple of glimpses that I saw of those things, people were like freezing their egg. I didn't know what that was. People were like telling me I should freeze my eggs. I also didn't know what that was. And I thought I have so much time, which is true, but is also not true because depending on your ovarian reserve and how you are as an individual, that may not be true regardless of what age and what stage you're at. But it was really, really important to me. So I actually froze several rounds of eggs and embryos. And for me, that was the best thing to do because regardless of how you want to start a family later, whether or not you want to use those eggs or embryos, at least they're there. And so that would be the main thing that I would tell everyone. For me, it was a point in which I felt like I was ready. I felt like I was able to take on the next task. And then it was like it couldn't happen fast enough because I had to be pregnant, then I had to carry the baby for like 40 weeks or 38 weeks in my case, both times. And it was almost like it couldn't come fast enough. But it was at a time where I felt like I'm very, very comfortable with my day to day. I'm very, very comfortable with the way I like run my practice. And back then, for my first baby, I was actually still at my other practice, but I was very, very comfortable with how everything was going. And I think there's a level of comfort that you are in your life. For some people, it's financial. For other people, it's like job stability. I don't know what it is. And for every person, it's different, whether or not they can articulate it. But there's a feeling so comfortable that you're ready to move to the next step. And so it was so evident to me. And I remember um, feeling like, oh, you know what? I can entertain that thought now. And it was a very stressful and traumatic pregnancy in the sense that I feel like those of us who want to control every aspect of everything in their lives, it's very difficult to be pregnant where you can't quite see, you can't quite know, and there's certain like, markers like lab tests and ultrasounds that let you know things are okay, but it's not enough for me. And I was also very, very sick, but I was still able to do everything I always did in surgery and in clinic. And so I never come back anytime. And that made me really happy because I never felt like I wanted to compromise what I really enjoy with what I may also really enjoy. And now I am able to, have both. Um, had my second baby about like 9 months ago. And so that's been really, really fun as well. It's definitely more difficult going from 0 to 1 than 1 to 2. It's a lot of work, but I feel like you kind of know what's going on. So the second baby, you're like, they're going to be just fine. So in fact, it's actually easier almost in certain respects. And so it's been really fun for me to enjoy that part of life that I hadn't really envisioned for myself, even though I knew at some point it was going to happen. And I mean, now my 2-year-old, who's like almost 2.5, he knows that I go to work, and he's learning the days of the week. And I asked him, what day of the week is it like today? And he was like, Friday. And I was like, what day of the week is it tomorrow? And he was like, tomorrow is Mama does not go to work day. And I was like, oh, that's perfect.
Oh,
I also know your routine. And so I think because of that, it's made me feel very, very comfortable that I haven't had to compromise myself in any way. I'm also super lucky that we have really good grandparents that are able to watch the kids when we're at work. And so that's obviously added a level of comfort that really allows me to do what I want to do during the day.
so cool. Yeah. And I personally like follow you on Instagram. I love that you share all like the breastfeeding stories
Oh yeah, it's
because
like
I feel like
right there, right there. I was hiding it. I was hiding it. It's
you
like
should not hide it. That like show that
yeah,
pump off proudly. Like I had our first baby in residency and I didn't really know anything about like pumping or breastfeeding or anything. And it was so daunting, especially when you're scrubbed in
yep.
to
Oh
try
yeah.
to try to figure out how to make it all work. But you're right. And then it all tends to work out.
It all works out. For pumping, I've actually like made this whole routine where I pump driving into work, pump leaving work, and those are 2 set pumps. I try to pump like 4 times a day. Now I'm actually weaning, but I try to pump 4 times a day for 30 minutes at a time. And I'll basically space it so that it's in between cases or different things. But it is truly a labor of love. I feel like people use labor of love all the time, and it sounds very nice, but pumping, breastfeeding, I don't know any greater labor of love than sacrificing your schedule, your body, everything that feels good,
Yeah.
maybe provide some breast milk for your children. And for me, it's something where I always um, thought I would want to do. And so I found a way to do it. But like you were saying, the first time, I didn't even know what the settings were supposed to be. I didn't even know how to connect everything. So then for the second pregnancy, I felt like those things were so much easier because you already know. And
Mhm.
I have 4 Spectra pumps, or one in the surgery center, one in clinic, one in the car, and one at home. And they
Love
just
it.
cycled as they get charged. so that I'm able to do that. But it's definitely one of the craziest things that I've done. And it's almost difficult to explain to anybody who hasn't done it. So,
There's no way, in my opinion, there's no way to explain the challenge, the joy, the amount of reward that you
yeah.
get from it all unless you just do it yourself. Yeah.
And it's difficult. So I feel like it's one of those things where I do want to complain about it. And I love that I have friends who I can complain about it to, but they also know that I care so much about it that I still want to do it. And so they'll be like, all right, but just do this and you can keep going. Because I feel like a lot of times you'll say something like, oh, this is so difficult. And someone will be like, well, then don't do it. And it's like, no, I want to do it. And so I want to do it. And I still want to be able to, talk with people about how difficult and challenging it is.
Similar to surgical residency, you're like, this is hard, but I want
Yeah,
to be here.
yeah.
Let's talk a little bit about the fellow that you guys share. So, talk about how you weave the fellow into your practice, how it works surgically. Um, does the fellow have any flexibility in terms of the cases they want to watch that week, or do they have set days with each of you?
So previously, when I did the fellowship, and that's what people say when they're very old, but when I did the fellowship, it was one fellow, and it was with Paul Nassif and Baba Kazizadeh. And then we started actually. I helped them apply for two fellows, and I joined the fellowship as a co-director. And so we generally have two fellows a year, and it is predominantly where they spend most of their time in one of the practices of either Paul or Babak. And during their times in which they don't have cases or certain set days, and there are set days, but that may change just depending on when all of us are at conferences, since all of us routinely go to a lot of conferences as well, then they will be able to spend time with me generally in the operating room, ideally in clinic as well. But I also know that with three very, very busy practices, it's not possible for them to spend every single day with all of us. So in general, they'll be able to come to the operating room with me. It's very, very fun because I feel like I'll be able to teach them lot of different things. The three of us have a little bit of different surgical emphases. And so I think that also makes it very nice, the collection of cases. I think the patient population for each surgeon is very different. And so a lot of times you'll see that a practice has a certain patient population or has certain kind of community that are the patients. And I think that's also very, very nice to see. I think one of the things that is the strength of our fellowship is that the three of us are very, very academic. We are always writing, publishing, teaching at conferences, but at the same time, we are three private practitioners. And so the combination of that was something that I never thought was possible growing up, in the sense that I thought if you were academic, you were literally at an academic center. And if you were private, you were so disconnected with everything, you obviously wouldn't have fellows and you may not be able to teach. It's completely not true. And I feel like that's kind of the best part of what we have to offer in our fellowship, is that you can truly have your own practice in which a lot of decisions that are big decisions, you get to make and have that autonomy, which is not necessarily the case if you're not having your own practice. And that is one of the things I think is very, very interesting. No matter where you have your practice, what type of practice you have to have certain business decisions and learn a little bit of business acumen in order to make your practice do well and in order to help the maximum number of patients that you can help. And so I think all three of us are very, very transparent. We also have very different practices, and even the culture of our offices, our type of practices, and even the caseloads are very, very different. So it allows them a lot of diversity, truly, to see all aspects of facial plastics. And also, I tell my fellows the best things in biology are from cross-pollination. And so what's better than a cross-pollinated surgeon? Meaning oftentimes you'll see three different ways of doing a deep plane facelift or three different ways of approaching a revision rhinoplasty case, whether you're using costal cartilage or any other grafting. And so it's very nice, I think, to be able to offer them both the breadth and the depth. We have a set schedule for them depending on the year and depending on who our fellows are. And we also encourage them, we have a lot of friends in the area, so we also encourage them to see anybody outside of our practices if they're able to, especially when we're away at conferences.
Yeah, that's such a good opportunity for the fellows that they have all three of you to learn from. What were some of the biggest like challenges or unanticipated things that you didn't know starting your own practice?
Um, I did a lot of research beforehand for a decade. So I would say just the nitty-gritty details of things. The global aspect of running a practice is the same, whether you're in an academic institution truly, or whether you're in a private practice, in the sense that you want to make sure your patients are well taken care of. That's the most
Mhm.
important. You want to make sure everything's organized, and you want to make sure you have a good flow, not just for clinic days, but for surgery days and for your staff or whoever works with you and alongside you. I think the nitty gritty things were the things that I wish I had like a checklist, because I'm really good at checklists, but I wish I had a checklist and you knew what insurance that you had to get or what you do when you are going to do like engage in lease. For example, I needed a lease attorney. Like I didn't know that. But nothing is so daunting that you feel like it would be a game changer. It's just that you didn't
Yeah.
know. And then I even remember the time was supposed to like be the first payroll. And I was like, oh my gosh, I have to run it. Like I'm the one that has to reconcile the times and actually run the payroll. And so it's like little things that I feel like are a checklist. Whereas I feel like the global concept of what you want to achieve in your practice, the aesthetics, you've probably long thought of, or even how you want the flow of your office to be and where you would put certain offices and rooms. I think those things are actually the easy part, but then the
Yeah.
little things, which are actually supposed to be the easy things, are the difficult part, because I didn't know you have to have certain insurances before you can even engage in a lease, or certain things before you can start remodeling. I've never remodeled a home or anything. And so to build this office, even though I didn't move the walls, I rebuilt everything and tore down everything. To do that, you needed certain insurances from the general contractor before the building would even allow it. And that was probably the longest, like most stressful time of waiting, where every day I was just emailing people asking, can you send this insurance? And it wouldn't be quite the right insurance. So then would they continue to take on your case and get the right insurance, or would they just say, forget it, find someone else to do your office? So probably those things I would say would be the more difficult part, where each thing's like a little checklist of things just to get it running, just for you to open your doors and to make sure that you have like a business license. If you're selling products, you need like to have a certain license to be able to sell products. All those things I feel like I sort of just figured out on the way. But nothing in the sense that I was really worried about or, felt like was really daunting.
Yeah, for sure. A lot of self-learning along the way.
Yes, yes, yes.
Um, I remember here, like we have our own surgery center, so I had to like figure out this whole CSOS certificate thing to order controlled substances, and it was just so onerous. I like forgot one check mark in one piece of paperwork, and that delayed my surgery center opening by 8 weeks.
Yeah, 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 yeah.
But there are some things you just don't learn until you do it.
Until you do it, yeah. So I'm actually the medical director at the surgery center I operate at, that Paul also operates at. But at that, just by being medical director, so I don't even have to do all of the checklist things that you had to do, but just by being there, it gives me a new perspective on the amount of things that have to be done before you're able to open your doors, and the amount of things that you have to do to maintain accreditation. And while we have all these teams doing it for us, it's really important that we also get an idea. And I think that that's one of the things that is really important, as my fellows go through fellowship, that they learn not only surgical technical skill, but also life skill, like how you would actually open doors to a practice or to a surgery center. And we like to help them with that as much as possible.
What things are you looking forward to either with your office, your team, your culture, and or surgically like in our field right now? What are the things you're most excited about?
Um, Surgically in our field, I just love seeing all the changes in surgery, honestly.
Yeah.
I feel like the basic technical skills haven't changed, but the way we approach the face and the nose and the conceptual um, ideology behind certain approaches are very, very interesting. And I think that evolving is the only way to become elite. And I really think that that's an important part I feel like about our field is that we never become so comfortable and so stagnant in ourselves and what we do that we forget that the global picture with many eyes and many brains and many sets of talented surgical hands would it be better? And so that's what I love at conferences. Of course, there are things that we are specialists on that I feel like I'm a specialist on that I will be love to teach and give talks on. But at the same time, I receive so much back just by seeing, everything that's going on out there. I think structural to preservation rhinoplasty is very, very interesting. And now structural and preservation, depending on the patient. I think those things are conceptual evolutions that have really changed the face of surgery, and I can't wait for more out there. Also, the way we approach faces and, deep plane facelifts, even though deep plane facelift has, obviously been around for a long time, just the way we approach different things, I think is very, very exciting that we're able to deliver very replicable results. So I would say so many things in surgery are exciting, but probably most exciting is the way we all kind of come together and teach each other what we've learned and what works well. And I love that things are very evidence-based nowadays in the sense that it used to be people would always say, well, I've always done it like this, or I was trained like this. But now it's like
Mhm.
papers that show these different volumetric analyses, or there are all these different things that show us how to get replicable, reliable, great results or efficacious treatment. And so I think that's a very exciting part. In my own life, I guess just continuing on growing practice and seeing what else is out there. I think everything is so fun that, I could always just keep doing surgery.
Yeah, there's definitely, it's wild to think about even year to year how much like new information you consume and like little tiny things that you do differently, but all those little tiny things globally impact your result and the recovery and yeah.
And I think like teaching is great because you can only affect change in so many patients in your lifetime with your hands. But sharing of ideas and teaching others, you're able to affect patients that are other people's patients and the same for them teaching us.
Yeah, for sure. What kind of content are you consuming right now? Like not necessarily surgically, but for fun. I mean, do you have any great books that you've read recently or podcasts that you listen to?
So I like to not listen to podcasts. Actually, and my fellows will know. On my drive-in, I listen to the same classical pieces, and I think about surgery. I almost play the steps of my surgery out, and I think about ways to do things better. Or if I have learned something, I think about how it is. So I really just kind of zone out. I truly am in the midst of the two and under chaos. And so much of my free time, whereas I used to read a lot, I don't really read. I used to run a lot. And I recently just started running last week. But I did do 2 days out of 3 days since I started. But I feel like part of being a mom in the postpartum process was a little bit of loss of self in the sense that while I maintained my surgeon self and I maintained that completely intact, part of things that were me did get a little bit lost the wayside. And I'm only beginning to get that back a little bit as I'm weaning from pumping and maybe spending a little less time doing certain things. And so, yeah, I'm excited to get myself back.
Yeah, it's so many of the things that you've said about being a mom, I feel like people are nervous to say out loud. But
Yeah,
like, I very much think of myself as a surgeon first, and then I almost feel guilty, like when you're like, well, I'm also a mom of two humans.
yeah,
But and then the loss of self for sure. It's like you have to give your patients everything. You know, you have to give your team all of you, you have to give your kids and your spouse all of you. And so oftentimes there are days when I feel like I didn't give anything to myself.
yeah, yeah. And I think for me, the part that I realized the most is I don't feel like I'm as fit as I was before. And so it's a constant reminder that clothes don't fit the same, nothing feels the same, things are still uncomfortable because you're pumping. And so it's like a constant reminder that I'm not quite myself. So I'm looking forward to getting more of myself back as I progress on in motherhood.
Well, if anyone is interested in getting a hold of you, Dr. Grace Slay Ping, where can they find you?
They can find me anywhere on Instagram or email me. My Instagram handle is at Grace Lee Peng MD. I also have one that's at GLP Face. And then otherwise, they can always email me at hello@graceleepengmd.com.
Awesome. Well, thank you so much. Congratulations on your career thus far.
Oh, thank you.
Opening your own practice. And thank you for being so open and vulnerable about some of the stuff that's a little bit harder to talk about.
No, thank you so much for having me. I've been looking forward to this for a long time. So